It's important to heed the warnings that come with prescription medications to avoid consequences that can sometimes be fatal. For this reason, a doctor asks about other medications or drugs you may be taking when considering a Suboxone treatment plan for opioid withdrawals. Suboxone is a combination of buprenorphine and naloxone, which is used to reduce withdrawals without the rewarding effects of an opioid. Using other drugs with this opiate-containing medication often results in life-threatening consequences. The opioid contained within the drug is called buprenorphine and works to mildly activate opioid receptors without the euphoric effect, while naloxone effectively turns off many receptors. Together, these actions reduce the powerful cravings and other symptoms associated with opioid withdrawals. Suboxone was designed to ease withdrawal symptoms, allowing for a higher likelihood that the patient will complete the phase of detox before treatment. Although the benefit of Suboxone has been scientifically documented, there is some risk associated with using the medication. Many substances don't interact well with Suboxone. Patients with anxiety disorders are commonly prescribed benzos to slow down the central nervous system, which relieve the symptoms of anxiety. The function of depressing the nervous system is also intended in the use of Suboxone. Using both medications without medical supervision may result in a coma, seizures, and in many cases, death. Cocaine, however, is a stimulant. The simultaneous use of cocaine and Suboxone work against each other, often enhancing instead of diminishing withdrawal symptoms. In addition, a dangerous concern for the use of cocaine together with Suboxone is an opioid overdose. With the substance and the medication both containing opioids, the standard dose of cocaine the patient may be accustomed to is generally more than enough to experience an overdose. Alcohol, like benzos, also depress the central nervous system. Drinking alcohol while taking Suboxone commonly produces dangerous side effects, such as respiratory failure, which can be fatal. The ready availability of alcohol to consumers poses a greater risk to patients who are taking Suboxone. Suboxone is designed to alleviate many withdrawal symptoms, including cravings. If you experience persistent cravings after beginning a Suboxone treatment, contact your doctor as soon as possible. Your needs may call for a dosage adjustment or a change in medication. In the meantime, reach out to a local support group to overcome them. To minimize the risk of abusing Suboxone, avoid smoking, snorting, or injecting it. In pill form, Suboxone works by satisfying the patient's cravings while rendering the opioid ineffective to the brain. When Suboxone is crushed, dissolved, or injected, the medication's chemical makeup changes, producing undesirable results. When not taken as prescribed, patients may experience swelling, difficulty swallowing, facial pain, and muscle spasms, and an unintentional overdose on the drug. Always use Suboxone as prescribed by your doctor. If you or someone you care about is misusing Suboxone, seek help immediately. Indicators that the drug is being misused include defensiveness about the use of the medication, the number of missing pills doesn't correlate with the prescription, multiple prescriptions are sought from multiple doctors, excessive time is spent thinking about obtaining the medicine, the patient no longer finds joy in old hobbies, the loss of control over the consumption of the Suboxone, and uncharacteristic behavioral changes. Don't use it if your intentions to overcome opioid addiction aren't earnest, and don't increase your dosage without the approval of your doctor. Despite its many benefits, this revolutionary medication for opioid detox still poses significant risks when not used appropriately. Become familiar with the consequences of improperly using Suboxone and avoid using other drugs while taking it unless your doctor approves. We hope that you found this video helpful and informative. On behalf of Find Suboxone Near Me, thank you for watching.